March Health Committee meeting to order.
Lawyers.
Under previous business, can we get a motion to approve the previous meeting minutes? By Brian, second by Brian. All in favor?
Any of the towns, yeah.
Number one, local law A, for 2018, local law of the County of Albany, New York, prohibiting the sale of tobacco and other nicotine delivered products in pharmacies in the County of Albany, New York. Public hearing last night. Yep. Any questions for Paul or?
Paul, I got a question for you. Was there any quantification as to how many establishments are selling tobacco or how many pharmacies are selling tobacco products in Albany County?
Yeah, there is, I raised that number last night, I don't have it with me right now, but 33 total. There's 3 Walmarts, we have Walgreens and Rite Aid,
That doesn't count the CVS that have opted out?
CVS are out, they've got 1 ShopRite, 7 or 8 shoppers.
How about privately owned?
None of them.
Okay. All right. All right. And how many other counties have adopted something like this in New York State?
Rockland in New York City. I can send you the actual counts if you need time.
No, I just want to get an idea. I just want to understand who's impacted by the legislation. Not really debating the merits of not selling tobacco, but kind of want to understand who would be impacted, and that was the answer I was looking for, whether it's local or not local.
Brian?
Not so much a question, I just a statement or something. I think we set up an economic development committee this year.
We did.
And I guess I have a little bit of a problem or issue that we're having a company come in, or we got companies in town, in this county, that are selling a product that whether we like it or not, and I don't smoke, and it doesn't make any difference to me one way or the other, because I don't smoke and the way my family smokes. But they do sell a product that is legal in the country, and we're going to tell them in Albany County, no, you can't sell it. And then on the other hand, we've got an economic development committee that wants to bring business into the county. And if I'm a business person, I'm going to say, I'm going to look at it twice and say, maybe I don't want to do that, because somewhere down the road, the county's going to tell me that I can't sell something that I'm currently selling or want to sell. And I guess I have a little bit of an issue with that. We're going to try to bring business in, and this product they're selling is legal, and that we're going against our own efforts to bring companies into Albany County. I've got a little bit of an issue with that.
Brian? Wanda?
I do hear, what you're saying, but what I would like to say in response to that is that there are, this is in reference to pharmacies, okay? And I do know of certain businesses in my district right now where they have a gas station. There's a liquor store over here. And then they have, where they sell, the soda and the chips, and all of that.
Which aren't good for you either.
Wait, let me finish. Okay, so they have the liquor store here, then this is where they do their groceries, right here, okay? And then around from that is their smoke shop, okay? And so they don't even sell cigarettes where they have their groceries at. Even so much as, moving the liquor, and all of this is in one little, mini strip mall. And so I think that we can already see the separation of the tobacco as far, I have evidence of it, in my district. And so the fact that we don't want to sell it in pharmacies, we're not saying that it still can't be sold in other places. I don't think that would have such an effect on businesses coming into Albany County. And I only bring this up because I just want others to know that, I already see the separation of the the tobacco, in certain businesses already. And if I hadn't seen it for myself, I kept saying, well, what's going on? And they moved that. The cigarettes are being sold in another.
I think most vendors, the Price Choppers and the drugstores and stuff, do a very good job of, for lack of a better word, hiding the cigarettes and stuff. They're behind the counter, they're behind smoke glass, very little advertisement other than a lot of which required by the state for the sale. Yeah, I hear what you're saying. I just have a little bit of an issue with us telling businesses that they can't sell something that's perfectly legal to sell. I would much rather see us as a county put together a coalition of health people, Cancer Society, Heart Association, maybe a representative of the Minority Caucus, the Majority Caucus, and go out and see if we can get the stores, the drugstores, the Price Choppers to give it up voluntarily, as opposed to us having to force it on them a little bit. And it's just my thoughts and ideas on it, and that's what I think we should be doing, as opposed to telling them, this is what you've got to do.
Well, let me say this. I originally carried this piece of legislation. And as far as the sale of tobacco in pharmacies, okay, I can see in different, like in my community, the way in which they sell tobacco, and not only that, certain cigarettes that are smoked by people in my community, and the way in studies how we feel that the cigarettes have been changed down through the years to ensure that people are hooked even more, onto them, okay? And then I don't know how many people here have a prevalence of Lucy's being sold in your communities, okay? But it's something that's really predominant in my community, all right? And I have to say that, nobody smokes in my house, okay? And I have noticed that even into the children, the parents, they no longer smoke, okay? But it's the incidents, and it happens in the high schools, and kids will go anywhere in which they're able to have access to tobacco. Cigarettes are deadly. I saw an ad on TV a few days ago that I guess the federal government has made the tobacco companies put out. I was shocked. I don't know if it was new, but I had not seen it. And they broke down every major tobacco company and talked about the ills of smoking cigarettes. It was really, I was shocked that I saw it, But this is something that we really need to do something about. Cigarette smoking is deadly. And you're in a pharmacy where you're supposed to be helping people get better, and you want to sell cigarettes, to me it's just it makes no sense now, and they're still making their money big time, okay? And so I just don't think that it's something that will affect businesses coming into Albany County. But I hear your point, though, in that we are trying to attract businesses. Make no mistake about that. I just feel that this is an issue that would not affect, what you're saying.
Ally?
Thank you. My apologies, Mr. Chairman, for my delay in arriving. And I find the discussion between Mr. Hogan and Mrs. Willingham to be very interesting, because I'm the district between the two of them. And so a part of my district has, we have a 33% poverty rate. One of the largest, people will know, I've been very vocal about this. Homeless, transitional housing for families that need it. And then I have the other side of my district, which is very different. And what is very interesting is that Mrs. Willingham is correct in that the marketing that I see of tobacco products and alcohol on one side of my district to the other is dramatically different. I did explore with the Tobacco Free Coalition the possibility of, because, and this was a piece of legislation I had to come around to, the Tobacco 21, that we could possibly avoid the issues of First Amendment violations. Personally, I don't think advertising falls in the wheelhouse of the First Amendment. Those are for individuals, but we'll get beyond that sort of philosophical issue right now. That we could require that any product that is age restricted in purchase be masked in places of business, any business, not targeting a single business, but any business where that product is not solely sold. For example, if you're going to a liquor store, you can advertise the liquor or the wine, etc. there, and if you're going to a tobacco shop, so that the exposure isn't there for children or people that are impressionable and picking up that product, so that's really where it is. Personally, I would prefer that there be a masking provision in this, which is something when this came around the last time, which I still would prefer that be in the legislation. I don't like that it just targets one business. As Mr. Hogan pointed out, there are other things that are sold at these places. People forget that alcohol is a human carcinogen. It has been identified as a human carcinogen for 25 years. And yes, it kills 0.1% less of the world's population due to disease-related factors worldwide. However, when you count in issues of domestic violence, car deaths, gun deaths, etc., there is a very large proportion, much higher proportion that involve, these deaths involve alcohol. And we still have alcohol sold at these retail stores that are attached to pharmacies. It's not an actual pharmacy, it's retail store that's attached to one, so that people can come in and spend their money in there. I have always had a challenge with this legislation because I would say 95% of the advocates really discuss their concerns about the advertising, and I absolutely agree with them that it's the advertising and the disproportionate amount of advertising that happens in low-income communities and in products that are targeted to communities of color. So I have not supported this legislation in this format.
Thanks, Ally. Todd?
So, some of the things that have been brought up here are great food for thought. With respect to a question for Joe, some of these you said were Walmarts, which have pharmacies within the context of the store, and you said some supermarkets as well, right?
Yes.
Okay, so they're not exclusively a pharmacy. They have certainly numerous departments, and they sell, beer and perhaps other things that may be less than healthful for people. Also, does anyone know if pharmacies are allowed to sell beer? I think they do. Okay, so they sell beer as well.
Beer, wine.
And, right, and so I think that taking on, Legislator Hogan's point, that it is not that restricting the sale of cigarettes in pharmacies affects necessarily businesses coming into Albany County. That's not the case. What I think he's trying to say, and what I'm trying to say, is it sets a precedent. That it says that we can reach into your business and take a legal product and say that you cannot sell it. Now, on the flip side, I think Legislator McLean Lane brings up an excellent compromise. And I'd like to hear from Joe whether he would consider this as a sponsor of the bill, which is that, Paul, I'm sorry, long day. Mr. Miller. Mr. Miller. Anyway, if he would consider the masking legislation, it might have a larger breadth of support, because we're not restricting the sale of illegal product, but we are saying you have to keep it out of the reach and exposure to, because it's age restricted, to youth. And I think that might be an excellent idea to amend this legislation and explore, as opposed to, on principle, banning a legal product from the sale by a small group of vendors. Consequently, if we were to ban the sale of cigarettes by all vendors, that might be a different story, because it's not exclusionary to one subset of a population. For my part, I have absolutely no qualms about keeping kids away from cigarettes, and I think it's an excellent aim. I think we might want to look at how we do it. With the voluntary, with CVS voluntary participation in this type of thing, it sounds like there's room to discuss with retailers options, and one of them could be a masking, particularly for retailers that have multiple departments. Also, they do sell cigarettes in every convenience store, I think, across the land, and that's certainly another point where kids might be seeing these things, and the masking, again, could be a big piece of how we could help on a wider spread problem than just exposure in pharmacy. So I put that out there on the table, as that might be one way to make this legislation a little bit more palatable. Thank you.
I always am very cautious when we're talking about pitting one business against another. And in this case, if we don't allow them to sell it in pharmacies, they can go to gas stations anytime they want, and the gas stations will probably sell more. So I believe that the last time this was brought up, we said, why don't we ban it from all stores and allow it only in specialty shops, such as they do
The
with
smoke
liquor.
shops.
Like a package shop.
Like they do in liquor, and a lot of states do that. That would be an equitable way of doing it. But I was very encouraged last night that since the last time, I don't know how long it's been, Wanda, since we talked about this before, 5 years maybe?
Yep.
2014. Since then, all the independent pharmacies have voluntarily decided not to sell. And the one that really piqued my interest is the fact that Price Chopper, whenever they turn a Price Chopper into a Market 32, they no longer sell cigarettes at Market 32. And Mr. Demowitz quickly pointed out that Wegmans, which is not in this area, but they don't sell them at all, which may be the reason Market 32 doesn't. But I thought that was very encouraging. Now, the coalition folks, the Tobacco Coalition folks, quickly pointed out that, but they can voluntarily say they aren't going to sell it, but they can also voluntarily say we are going to sell it if there is no law in place. So that's something I'd like to bring up to the discussion. Package stores are something that maybe we should think about, but I am encouraged by the fact that most of them are voluntarily taking them off the shelves.
Thanks, Sean. Brian?
I do have a separate question, but I do have to say, I think Allison and Todd and Brian have raised very, very good points. I do find it hard to believe that kids see tobacco products in the pharmacy and must think they're healthy. I think that's insulting to kids. And I think it really raises questions about the billions of dollars that we have spent in taxpayer money educating about the evil and the harm of tobacco. I don't believe that's the case any more than they see 40s and wine coolers and wine in a pharmacy and think it's good for them. That being said, I have a more specific question for the sponsor. Under the definition of electronic aerosol delivery system, is that meant to include vape pens?
I'm sorry.
Is that meant to include vape pens?
Talking about electronic smoking?
Electronic aerosol delivery system.
I'm not sure, don't understand what you're talking about, vape pens, but talking about like vapor smoking, is it?
Yeah, a vape pen.
I never heard that term, but yeah, it does include vaporizers, that's right.
Okay.
Nicotine delivery systems with vaporizers.
Okay, but a vape pen, my point is it doesn't have to be a nicotine delivery system. It could be for, and often is for medical marijuana, which is completely legal under New York state law. So would this mean that a vape pen, for use in medical marijuana would be illegal in pharmacies in Albany County?
No, this is licensed under the Food and Drug Administration, it's
You can't
Okay,
smoke
because
marijuana.
cannabis is a Schedule I substance under federal law, so it's not licensed under Food and Drug Administration. So
Is it? Is
my-
it, is it? I don't,
I'm not sure how you're getting around this. If a vape pen is used for medical cannabis,
I don't think so. Not what I've seen.
It is breaking federal law,
yeah,
In New York State?
yes.
yeah.
I was just looking at something.
So my concern with this is, so a medical marijuana patient in Albany County has to find one of only 20 doctors who practice this type of medicine. It's not a lot. Would have to go to one of 2 dispensaries in the entire county to get a medical marijuana product, and now couldn't even get the delivery system for the oil at a pharmacy.
They can't, I mean,
That's the
that
problem.
point right there, that they can't get the marijuana at the pharmacies either, so I'm sure they can get the, whatever they need to dispense it at the dispensary.
No, they can't.
What?
No, they can't.
You could,
You buy the
yeah,
product at a dispensary.
Is that-
only 2.
What's that? There's only 2 dispensaries in all of Albany County.
Right,
You've
right.
heard.
So are
right.
we,
Well, then they have to get it some
Legal
other
dispensaries.
pharmacies.
but is that okay?
Right.
Is that okay? If they are a licensed medical marijuana patient by their physician and by the New York State Department of Health, why shouldn't they be able to get the delivery system for the medicine at the pharmacy? We keep hearing how a pharmacy is a place of health. This is medicine.
I'll look into that.
Okay.
I think, Paul, this was tabled in law, correct?
Yeah,
Would
yeah.
it be okay if we table it?
Yeah, that's what I thought we were
And
doing.
what we'll do is, we table the
You got a
request of
question, Bill?
response, and we can get these clarified in the local law. Thank you.
Ray? Go ahead.
Just to summarize here, I mean, Mr. Miller, are you willing to consider some of the objections and suggestions as of today?
I will look into, Brian's issue.
If anybody has questions or objections, you should send them to Paul before next month.
Bill?
Mr. Chair,
Ray?
Bill?
just by way of information, I remember the IDA, and we just approved down in Ravina, a facility medical marijuana dispense. So, I mean, they're coming online, is the point. And so there's a new one, probably in the summer, will be in operation.
Okay,
Just
thanks.
by way of information.
Good to know, thank you, Bill. Okay, under current business, number 2, resolution number 130, public hearing on proposed local law number E for 2018. That's Brian's,
Yes.
that's just a public hearing, you wanna,
Yes, and we did come out of law with recommendation to move the public hearing. I would like to have the committee here do so also.
make motion by Sean, second. For the local law, for the public hearing, by Ally, all in favor? Any opposed?
Okay.
And, is that Allison?
You could add me too. I don't hear.
Oh, okay, we need a motion to amend the date to April 24th. I get a motion by Ally, second by Dennis, all in favor? Any opposed? You know, if we could pass the motion as amended to.
Could you put me on that one too, please?
Yes.
I don't hear it. I want to be on all the clear ones.
Pass it as, okay, as amended, public hearing, local law number E, 2018, for April 24th.
I like the environmental.
Motion by Dennis, second by Wanda, all in favor?
Aye.
Opposed?
Can't make this.
Number 3, resolution number 134, resolution to initiate a pilot polystyrene recycling program. I understand is being tabled by the request of the sponsor, is that correct? Okay, thank you. Number 4, local law number E for 2018, local law to prohibit the use of conversion therapy for minors in Albany County. We're going to table that, the request of the sponsor, awaiting the public hearing. Number 5 is authorizing an agreement with the New York State Office of Alcoholism and Substance Abuse Services regarding an open access center and amending the 2018 Department of Mental Health budget. Mr. Giuliano.
Good evening, Mr. Chairman. Thank you very much. This is a follow-up to Resolution 449 in November of last year when we asked permission to apply for this grant. Oasis awarded 10 grants across the state earlier in this month. This is $248,000 to partner with 2 of our community providers, Catholic Charities and the Addiction Care Center of Albany, to put on the street 24/7 case managers, peer navigators to try to increase the access to addiction treatment. We're also looking to put a half-time nurse into our department to help coordinate this. This is part of the governor's heroin response, and we hope to get that up and running fairly quickly.
Any questions for Dr. Giordano? I get a motion to approve by Brian, second by Brian, all in favor?
Aye.
Any opposed?
Thank you very much.
Thank you. Number 6, authorizing an agreement with the Health Service Research Incorporated regarding the expanded partner services program.
Good evening, Mr. Chairman.
Justine, how are you?
Dr. Wheeler could not be here tonight. I am Shannon Witherspoon, Assistant Commissioner of Finance for the Health Department. For this RLA, we are requesting to go into contract for our expanded partner services program. This is for $105,000. It is already budgeted in our 2018 budget. The goal of this program is to reconnect HIV-positive individuals who show no signs of receiving health care for at least 13 months.
Representative State Fund, any other questions for Ms. Witherspoon? Hearing none, can I get a motion to approve by Brian, second by Dennis, all in favor?
Aye.
Any opposed? Number 7, authorizing an agreement with the New York State Department of Health regarding the immunization action plan.
This is a contract request for a 5-year term from April 1st, 2018 to March 31st, 2023, with the first year of grant funding at $154,423, which is already in our 2018 budget. This program seeks to remove barriers to immunization for adults and children, and one of the main goals is to ensure that 90% of all children in Albany County are completely immunized by their second birthday.
Any questions from the committee? Is that a motion, Sean, or a
Yes,
first? Motion by Sean, any, second by Dennis? All in favor?
Aye.
Any opposed? Thank you for joining us tonight. Motion to adjourn?
Thank you.
By one more. In favor?